my name is Dr. Dina, and I'm excited to introduce Vulai, a revolutionary powered diagnostic microscope built to provide accurate, fast, and scalable diagnosis for visceral leishmaniasis. In regions such as West Pokot in Kenya, we have several cases of undiagnosed visceral leishmaniasis. This leads to further spread of the disease, making it a challenge to achieve the WHO goal of ending neglected tropical disease by 2030. This is because of limited diagnostic tools and poor disease surveillance, which worsens the situation. Our inspiration comes from the story of Lucy, a technician who missed the diagnosis of visceral leishmaniasis in a child 2 years ago. Due to the delay, the child unfortunately succumbed. This story drives our mission to prevent such mortalities through technological innovation. The map is of our country, Kenya, and it shows West Pokot as one of the counties that is majorly affected by visceral leishmaniasis. Next, we have a line chart that shows a worrying upward trend in visceral leishmaniasis cases in Kenya, with over 1,000 cases reported annually over the past 5 years. The pie chart shows that despite having several cases of visceral leishmaniasis, resource allocation for disease monitoring and evaluation remains low, highlighting the need for improved diagnostics. Vulai is more than just a diagnostic tool. Together, we can reduce the burden of visceral leishmaniasis and create healthier communities. Join us in making timely and accurate diagnostic healthcare a reality.
So the next page shows one of the wireframe we developed that can be used by the local medic in addressing this situation. So as you see, the first page is the login page, whereby the user now will be required to key in the username and the password. We have the second page, which shows the patient information. So in that part, the local medic will be required to capture in the patient information. We have the analysis part, and we also have the statistics part. So the patient information is where the patient biodata will be taken once the patient presents him or herself to the local clinic or dispensary or laboratory. And then once that is done, shows the blood samples that have been taken from the client ready for analysis. So we implemented the date of birth, and we changed it to age. So in this case, the user will now be required to just put in the patient's age. And of course, now the issue of graphics, now we took it into consideration so as to make it more engaging and more presentable.
We will expand our AI model capabilities, improve training data sets, and deploy systems to high-risk regions. Your support will help us bring this life-saving technology to those who need it the most. What makes Vulai unique is its ability to deliver accurate, speed, and scalability. The model minimizes the risk of misdiagnosis, facilitates timely treatment, and makes quality healthcare accessible to remote communities.